So today's chat is going to be a little bit longer than some of our talks that we've had in the past. I wanted to revisit the issue of ruptured silicone breast implants, or ruptured breast implants in general. But it's a question that comes up all the time. Breast augmentation with silicone implants remains one of the top one or two most popular procedures in the entire world of cosmetic surgery. And the question always comes up about ruptured breast implants. What do we do about them? How do we manage it? And so on. So I'm going to take a couple of minutes and walk you through the entire process. Let's start with a little bit of history. Let's talk about saline implants for a minute. So a saline implant is a silicone shell filled with salt water. If that implant breaks, it's pretty obvious because the breast disappears, the patient knows that it's gone, they tell their surgeon, and we manage it. In the old days, we used to have silicone gel implants that were not very thick consistency. They were pretty runny. If the implant broke, it was usually pretty obvious. But these days, we have the best silicone gel implants we've ever had, and we describe them as cohesive silicone gel. They're kind of like Jell-O. They're thick, they're not really liquidy, and it is at least conceivable that if that implant was to break or have a little crack in the shell, that it might not be obvious either to the surgeon or to the patient. Now, the good thing is a spontaneous rupture of one of these implants is actually pretty uncommon. We don't see it very often, but it can happen. It can happen spontaneously. It can happen because of some trauma. Maybe a patient has a fall or an impact in a car accident or something like that. So the truth is that if a patient is walking around with a ruptured silicone gel implant, that's not the best situation. We'd like to manage that. So how do we do that? Well, the first and the simplest thing that we do is at the Cosmetic Surgery Clinic, when we do breast augmentations with implants, our patients are invited to come back to see us regularly every 2 or 3 years forever. So, we do the surgery, we have our regular post-op care, and then every couple of years, patients come back, we have a chat. How does it look? How does it feel? Any questions? Have you noticed any changes? Are you happy? So we do that. But in addition to that, right in the clinic, at the bedside, it takes 2 minutes, we do an ultrasound exam. So I have a little handheld ultrasound device, goes on the chest, and I can see in real time, is the implant broken or is the implant intact? And it's an extremely reassuring test because usually they're intact and everybody's happy. The issue is that traditionally the best way and the only way to see if the implant was intact or not was to do an MRI. Now, an MRI is a great study. It remains the gold standard to look at the integrity of the implant. The trouble is, in a lot of parts of Ontario and Canada, getting an MRI is really difficult. It takes a long time. There's a long waiting list. If you want to go private, sometimes you have to pay for that. And so we try to use the ultrasound as a really good bridging technique to give us the information that the MRI would give us without having to go through the rigmarole of the MRI study. So that's really super helpful. Now, what happens if the implant is ruptured and the patient says, my God, my breasts are great. They look fantastic. I don't feel any different, but you're telling me it's broken. What do we do? So the most important thing to realize is that while it is not a medical emergency, we don't need to replace it like that day. It's the best advice is to replace the implant. We would not knowingly recommend to a patient who has a broken silicone gel implant that they leave it alone. That's not the recommendation. Why? Because when these implants are designed, they're designed a certain way, they're engineered a certain way, they're built a certain way, and that is to be intact in the body, not to be ruptured in the body. So when we look at long-term outcomes from breast augmentation patients, the data we have is based on implants that are intact. We don't have data that tells us what happens to a patient in the long term if the implant is broken. So we don't feel comfortable telling a patient, it looks okay, just leave it alone and we're never going to change it. That is not the suggestion. So managing a ruptured implant is usually not a big deal. If the goal is to just take out the broken one and replace it with a new one of the same size and style, that is a pretty straightforward and easy operation. Sometimes, depending on how much time has passed since the original surgery, we might want to do something else. Maybe we want to increase the implant size or decrease the implant size, or do a little breast lift or some fat transfer or something like that. And that can make the operation a touch more complex, but they're usually pretty straightforward overall. So that's the story. If you have breast implants in place and nobody has checked you out for more than a couple of years, it's a really good idea to call your surgeon, go have an assessment, see what's going on. If that doesn't work out for you, we are always happy to see you here at the clinic, and we'll take care of you. So that's the story for now. I look forward to chatting some more, and give us a call if you have any questions about your implants.